The number of individuals that do not get resolution from antibiotics for SIBO is staggering. Are you one of them? Antibiotics have become the medical management for SIBO, but failure and side effects are more common than often stated. If you want resolution, stop looking for the next antibiotic combination to take, and let's talk about how your next move should be focused on correcting underlying causes. No one sets out to fail, especially when it comes to their health. Unfortunately, when you're trying to address a problem, having too narrow of a view on the issue nearly guarantees a low success rate. Personally, I think life is too short to consider a half-hearted approach. We can do better. But before we talk about this, allow me to introduce myself. I'm Dr. Arland Hill, and for over 20 years I've been helping first-time and recurrent SIBO sufferers restore their gut function by targeting all three phases of the condition to resolve symptoms in a timely manner. First of all, how do we know that antibiotics fail? Well, if your symptoms are still present immediately after stopping antibiotics, within days, there's a high probability that the antibiotics failed. We're not talking about waiting weeks or months for symptoms to return. We're talking about return within just a few short days. And that's an indication that the bacterial load has not been reduced enough. What we might otherwise say as it was ineffective decontamination. You didn't reduce the load of bacteria and you didn't reduce the overgrowth. This could also be a problem because it could exacerbate antibiotic resistance and ultimately make the long-term situation even worse. But let me contrast this against when symptoms return in weeks or months. There's a delay before the symptoms return. Well, this is not likely an antibiotic failure. It could be a lack of adequate diagnosis about what you're actually treating. For example, you may be dealing with Candida, the fungus, which is often termed SIFO instead of SIBO, or you could be dealing with methanogens, what's often termed IMO. You could be dealing with insufficient amounts of adequate antibiotics or antimicrobials. Certain scenarios dictate that using more than one antibiotic or combinations of antimicrobials is a far better approach than trying to use either single antibiotics or single antimicrobials. But most likely, it's a lack of acknowledgement of the underlying causes. So what's the real reason that antibiotics fail? Well, let me ask a few questions here. How often have you been given guidance on targeting the root cause of SIBO? Did anyone discuss with you that the root causes are the primary problem? Antibiotics and antimicrobials don't matter if you're not correcting the cause. So with that in mind, here's the next 4 things that you need to do. Number 1, you need to introduce a course of effective antimicrobials. It needs to be broad spectrum, not relying overly on one particular antibiotic or antimicrobial. And it needs to be able to have the ability to address bacteria, fungus, methanogens, which are also called archaea, and more even. And that generally is going to be executed better with your botanical or herbal antimicrobials because you can introduce so many more effective agents at one time as compared to trying to implement this with an antibiotic. And it's also going to overcome the issue of resistance. But remember, that whole point is just touching the surface. We need to get to the underlying causes. And what do we do, or how do we go about doing that? Well, the second thing we need to be thinking about here is we need to replace digestive secretions. So in the stomach, that means we need to think about replacing hydrochloric acid. When we talk about the small intestine, that brings into the conversation the gallbladder and the pancreas, and the gallbladder is going to secrete bile. So is our bile production and release sufficient enough? Well, what about from the pancreas? That includes the conversation around pancreatic enzymes. All of these are going to deter the overgrowth of these bacteria in the small intestine. These are all inherent defense lines. So they're not just there for the purpose of digesting food, they're also there to help keep the microbial levels down as well, or keep the microbe levels down as well. And they all inhibit microbial growth. And every mechanistic study, for the most part, that you read on SIBO talks about this. It emphasizes just how important it is to address these components related to digestion that also act as defense lines. But let me ask you, do you need help implementing a structured plan for SIBO? Well, I got you with the SIBO Solution. The SIBO Solution is a 3-phase approach that takes all of the information I'm sharing with you here and walks you through how to implement it. If you're ready to stop dealing with SIBO, get started now by clicking the link in the description. Now, the number 3 thing that we need to be thinking about is keeping your bowels moving. Motility is huge. The slower your bowels are, the more probability that you're dealing with SIBO. In fact, slow motility almost guarantees SIBO, if you will. Think about a couple of major conditions here that are linked to your bowels not moving as efficiently as they should. It's probably not any coincidence that these are also conditions in which we see SIBO manifestation at a much greater rate than the average population. Things like hypothyroidism, Parkinson's disease, advanced diabetes. These are all going to have higher rates of SIBO. Slow bowels equal longer time in the small intestine, so things aren't moving through the small intestine and getting flushed out as efficiently as they need to. They're not transitioning over to the large intestine. As we transition and move things efficiently through the small intestine, that reduces the risk of overgrowth. But if that small intestine movement is stagnant, well, that's going to do the opposite, and it's going to promote overgrowth. Now, let me give you the 4th thing that you need to be thinking about here, and that's diet. Now, some of you may have heard the FODMAPs diet. Well, I'm not going to recommend the FODMAPs diet, and in fact, I'm going to suggest that you avoid the FODMAPs diet. And yes, this is contrary to everything that you likely have heard and read up to this point. But if you want to see a full breakdown on why the FODMAP diet is not the ideal diet for SIBO, well, hit that subscribe button. Next week's video is going to do a deep dive into this exact topic. Instead, and this is the more important thing, what should you be doing? You should be eating a clean diet that focuses on whole foods, emphasizes higher protein, avoids refined foods, your ultra high processed foods, and it doesn't overly constrict the diet. Now, if you're still uncertain if a SIBO treatment is working, well, let me help you out. Here is a video on this exact topic.